We are staying on top of that breaking news out of Washington, the Biden administration declaring monkeypox a public health emergency. This move will free up additional resources for vaccines, treatment, and tracking as this disease spreads across the country. Our medical contributor, Dr. John Brownstein, with me now. Dr. Brownstein, great to see you. How big of a deal is this? How concerned should we be?
Well, Deidre, the challenge is we are seeing uncontrolled spread across this country. Over 6,000 cases have been documented, likely many more. And we need resources to stamp out this virus. We need resources in testing, tracing, vaccination, education. We're finally seeing the federal government ramp up response by appointing key officials, and now declaring this emergency allows us to really unlock resources to fight the virus. We need ramping up of the testing and tracing. We need, of course, an ability to deliver vaccines. There's so much more demand than we actually have in supply. So being able to ramp up the effort to make vaccines available. And so we have to do everything we can to prevent monkeypox from becoming endemic. We have a window of time, and this is the moment to really ramp up that response.
So remind our viewers, if you don't mind, of the symptoms of the disease. What should we be monitoring?
Okay. Well, first of all, for most people, the risk of monkeypox is incredibly low. So let's make sure we understand that this is not COVID in the way that it's spreading rapidly. That being said, the symptoms include fever, headache, muscle aches, backache, some of the common symptoms we get from infectious diseases, but then also we have that rash that looks like pimples or blisters on the face and mouth or even elsewhere. So definitely be on the lookout for those symptoms. And if, of course, you're interacting with people, those symptoms, of course, practice some caution to make sure that you don't create an exposure for yourself.
So how does this spread, and again, under the category of protecting ourselves and others?
Right. So for what we know, and we have to be humble here because we're still learning about this virus. This virus has been underfunded in terms of research, so we're still learning more. But for the most part, what we think it's close contact, mostly through skin-to-skin touching, but can potentially be transmitted via clothing or respiratory droplets in close range. So people need to avoid, that skin-to-skin contact with someone who has a rash that might look like monkeypox. Avoid sharing utensils and bedding if that person is known to be positive. And of course, something that works for really any infectious disease, keep washing your hands and maintaining basic hygiene.
So, Dr. Brownstein, you're the Chief Innovation Officer at Boston Children's Hospital. What about parents? I mean, we've heard of a few cases in kids so far. What advice are you giving to parents?
Well, first of all, don't panic. The risk to kids is incredibly low. Yes, we've seen a small number of kids, 5 so far, come up with this virus, and that is likely through household contact. We spend a lot of time with our kids, and if you happen to be positive, there's a chance that you could spread it to your kids. But overall, the risk to our kids is incredibly low. But of course, watch out for their symptoms, and of course, consider the exposures that those kids might have, and make sure that, of course, they're practicing those basic hygiene principles that really work for anything as well.
Dr. Brownstein, I heard you talk about a window of possibility to address this, which is presumably why the Biden administration made the decision that it did. How does this public health emergency compare to steps taken early on for the coronavirus pandemic?
Well, we know very, easily that, COVID response was slow, and it led to, as we know, deaths that were really unnecessary because we didn't educate the public about basic prevention. We didn't ramp up a response quick enough. Here, of course, we're hopefully not repeating those lessons of the past. Ramping up testing, making sure it's equitable, making vaccines available, making sure those are equitable. There's a moment where, this virus could be potentially stamped out if we do the basic public health measures, the testing, the contact tracing, the real education about symptoms. We do have an opportunity, unlike COVID, which spread incredibly efficiently. This virus doesn't spread as easily. So we do have an opportunity to get this virus under control until, the moment that, that we're all hoping won't happen, which is it becomes sort of a cycling virus that we have to deal with for years to come.
Dr. Brownstein, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.